Thank you, Chairman. Great remarks. It is now my pleasure to introduce the 2013 Physician Assistant Student Commencement Speaker, Sean Croteau. Sean was born in St. Petersburg, Florida. He received his Bachelor of Science in Athletic Training and Sports Medicine from Florida State University and a Master's of Education from St. John's University in Queens, New York. Sean worked as an athletic trainer in Florida and New York. At MCPHS University, Sean was the class vice president, Student Association of the American, served on the Curriculum and Academic Review Committee and the Admissions Committee. He was a peer mentor for the first-year physician assistant students and served as secretary on the Campus Activities Board. Following graduation, Sean plans to move back home to Tampa Bay area to be close to his family, friends, and to be reunited with his fiancée, Gloria. Make sure you bring a cooler full of snow when you go. He will obtain a position as a physician assistant in the Tampa Bay area, where he can continue to grow both personally and professionally. Sean, please come to the podium.
Stanford University had Steve Jobs and Oprah Winfrey. Harvard had J.K. Rowling. Tulane had Ellen DeGeneres. The University of the Arts had Neil Gaiman. And today, you all have me. So what is the significance of the people that I have just mentioned? Well, excluding myself, they were just recently voted by Brain Magazine as giving the top 5 graduation speeches of the last decade. So, I say to you again, today, you all have me. Now, I know what you're probably thinking, and quite frankly, I've been thinking the same thing. How in the hell did that happen? How is it that among all the big names of commonplace that we've seen giving graduation speeches across the country each and every year, how is it that I got chosen to speak here today? Now, I've thought long and hard about this, and I've come up with one conclusion. Budget cuts. All joking aside, though, I feel that it is a privilege for me to be a student representative speaking in front of you all today, and that I'm able to share the stage with our highly esteemed keynote speaker. He's a pillar of the community, former mayor of Manchester, and the founding president of the Catholic Medical Center, Dr. Dupuy. So, regardless of how I came to be speaking here before you all today, I am grateful and honored for the opportunity. My fellow graduates of MCPHS University, class of 2013, it's all right. Today, it is all about us. We have worked extremely hard to get to this day. And it's okay to bask in this glory a little bit and to feel excited and proud about our accomplishments. Graduating today, we have students from the dental hygiene program, students from the nursing program, and students from the physician assistant program. We have all come a long way. We have gutted it out through the vigorous coursework and the late night study sessions. We have sacrificed our time, our social lives, and having to be away from family and loved ones longer than we would have liked, all to be sitting here today. But we made it. Now we are graduating. It is time to move on to the real world and apply the skills that we have learned. We have the education. We have the knowledge. But that alone will not make for a great clinician. We must remember, you treat the patient, not necessarily the disease. I remember a question that a doctor asked me a few months ago while I was out on one of my clinical rotations. He asked, when a patient leaves your office after an appointment, what is the one thing you would want that patient to remember about you and your role as a practitioner? My response was, I hope they felt that I care. There are a lot of qualities that make for a great clinician. Intelligence, confidence, work ethic, application actually feel that you care has to be right up there at the top of the list. And if you show that you actually do care, then pretty much all those other qualities will fall in place right along with it. So care. C-A-R-E. Those 4 letters that make up the word care can easily be a guide, a mnemonic device of sorts, that if we follow, can have us all well on our way to becoming great clinicians. C, compassion. A, attitude. R, represent. E, evolve. So starting with the letter C, compassion. The Oxford Dictionary defines compassion as the sympathetic pity and concern for the sufferings or misfortunes of others. So treat your patients compassionately, the way you would like to be treated if you were in the same position. Treat them the way you would hope someone would treat your own mother, father, grandmother, grandfather. Now, onto the letter A, attitude. Attitude goes a long way as to how people will view you and respond to you. As hard as it may be sometimes, we must try to always keep a positive attitude. When it comes to the importance of attitude, I think author Charles Swindoll put it best, and I quote, "The longer I live, the more I realize the impact of attitude on my life. Attitude, to me, is more important than facts. It is more important than the past, than education, than money, than circumstances, than failures, than successes, than what other people think or say or do. It is more important than appearance, giftedness, or skill. It will make or break a company, a church, a home. The remarkable thing is, we have a choice every day regarding the attitude we will embrace for that day. We cannot change our past. We cannot change the fact that people will act in a certain way. We cannot change the inevitable. The only thing we can do is play with one string we have, and that is our attitude. I'm convinced that life is 10% of what happens to me and 90% how I react to it. And so it's with you. We are in charge of our attitudes." End quote. Powerful words indeed. Next, letter R, represent. Represent your profession well. We need to take pride in what we do and know that how we portray ourselves reflects on our profession as a whole. Last, the letter E, evolve. We must evolve as medical advancements evolve. Learning each and every day is a necessity if we want to go on and become great clinicians. It has been well documented and pretty much universally understood that with the changes in the healthcare and the aging baby boomer population, that as future medical professionals, we are going to be looked upon to fill the ever-growing void in the healthcare system. We have to continue to work hard to become the practitioners we want to be. And perhaps, more importantly, we have to work hard to become the practitioners that society needs us to be. So just to conclude, there isn't going to be a Steve Jobs or an Oprah Winfrey walking through those doors and up on a stage today to give us all words of wisdom to live by. But if we show that we care, if we show compassion, have positive attitudes, represent our professions to the highest quality standards, and continually evolve as clinicians, then who's to say there isn't a Steve Jobs or Oprah Winfrey type sitting amongst us here today who will go on to have an impact similar, if not even greater than they have had in the world. Congratulations, graduates. Continue to work hard, get better each and every day. And remember, let everyone see that you truly do care. Thank you.
All right.
Thank you, Sean, for those speeches to the fellow graduates. You'll have the usual in the future for our commencement speech.
All
We
right.
are very fortunate to have as our speaker today a leader in healthcare